Good evening and Merry Christmas, everybody. This is Nurse Eunice with Florida Training Academy, and I cannot wait. This evening, we have 100 practice questions to help you pass your home health aide examination. So, whether you are a CNA who is interested in working in the home or you are strictly involved and dedicated in taking care of clients in their home environment, this practice test is for you. So, I see that we have some viewers who are commenting that they passed their examination. So congratulations on passing your test. And if you haven't yet passed both parts, it is okay. You all usually get multiple attempts to pass your clinical and your written test, and I am here to help you succeed. So let's get started in 5 seconds. All right, so welcome to this essential practice test session designed specifically for CNAs and home health aides or HHAs who provide care in the home setting. So that's right, as a CNA, you can work in facilities, but you can also work in the home. As a home health aide, it limits you to the home, but usually there is just a test issued at your facility where you received your training. There isn't a national or a state examination. So it's sometimes easier to become a home health aide than it is to become a CNA. In today's video, we'll be focusing on practical techniques and best practices to ensure safe, compassionate, and effective care for your clients. From feeding clients with dysphagia to preventing bed sores and navigating family dynamics, we'll cover real-world scenarios that you may encounter every day. Whether you're new to caregiving or a seasoned professional, this video is packed with actionable tips and valuable insights to help you excel in your role and enhance the quality of life for those in your care. So let's get started and empower you to make a meaningful difference in the lives of your clients and your families. All right, if you haven't done so, don't forget to like, subscribe to our channel, and share the video. We have practice questions. We also have clinical skills videos that are helpful for CNAs, home health aides, nursing students, and just caregivers in general. So let's get started, team, and Merry Christmas, everybody. All right, so question number 1, we're starting off easy. What is a home health aide allowed to do with a dressing? Is it A, apply sterile dressing, B, reinforce a dressing, C, remove a dressing, or D, none of the above? And I'll give you about 5 seconds to enter your responses in the chat. 4, 3, 2, and so I am loving that I get to introduce you to new information. A home health aide can do B. They can reinforce a dressing. So let's say a dressing is partially coming off, or if it's bloody, they can add a new dressing on top of the original dressing, or they can add tape. So home health aides can reinforce a dressing, but cannot change sterile dressings, as this requires sterile technique. Question 2, can a home health aide apply a hot pack? What do you think, team? A, yes, as long as safety guidelines are followed. B, no, because only nurses can apply heat. C, yes, but only with a physician's direct supervision. D, no, applying hot packs is unsafe. Think about what a hot pack would be used for and whether or not you think a caregiver who's in the home would be able to apply such a therapy. And I'll be revealing the correct answer in 3, 2, and yes, they can. Nikisha, you have it. Let's see if anyone else has it. So yes, as long as safety guidelines are followed, you don't want to heat it for too long, and you don't want it applied to the skin for too long. So home health aides are trained to apply hot packs safely as part of the care plan. We call it a warm compress. All right, question 3. Is giving an enema within the scope of practice for a home health aide? A, yes, under supervision. B, no, it requires advanced medical training. C, yes, but only for adults. D, not unless the state approves doing so. And this one is tricky. Is a home health aide allowed to insert something into someone's body? A medication. And now I'll reveal the answer in 3, 2, and this one is tricky. It is D. So some of you all chose yes, and you're not wrong, but every state is different. So whether you're a CNA or a home health aide, you have to know what the state requires. So whether a home health aide can give an enema depends on the state regulations. Some states allow home health aides to perform this task under specific conditions, such as supervision by a licensed healthcare professional, aka a nurse, while others prohibit it entirely. So you have to be, aware of the requirements for your state. And when in doubt, you can notify or ask your nurse, but you would not be under direct supervision of a physician. You would be doing this under the supervision of a nurse if your state allowed you to do so. Question 4, can a home health aide administer medication? A, yes, if the client requested. B, no, it's not within their scope of practice. C, yes, but only oral medications. D, yes, with proper training. Can a home health aide, a person with a certificate, give medications? And now reveal the answer in 5, 4, 3, 2, and the answer is no, it's not within their scope of practice. And I know what's tricking you is because you've seen people in the home and they're helping with the medications. Well, the home health aide can give medication reminders, but if she touches a pill, he or she, they step outside of their scope of practice and they're acting in the role of a nurse. But they can hand the pill organizer to the patient and remind them that, hey, today is Monday, it's morning, open up the pill container and take those 2 pills out that either your nurse or your family member has placed inside of it. So here's the rationale. Administering medication is outside the home health aide's role and must be done by licensed professionals, aka nurses. Many states legally clarify the home health aide can provide medication reminders, but cannot physically touch a pill. So they cannot administer medications. And Valua, I am so proud of you. Congratulations. What a way to end the year. Certified. I love that. Question number 5 is a long one. What is the primary difference between a sterile dressing and a bandage? And how does it relate to the duties of a home health aide? A sterile dressing is used for minor cuts, while a Band-Aid is for surgical wounds, and both can be applied by a home health aide. B, a bandage is always sterile, while a sterile dressing does not require sterility, and both can be applied independently by home health aides. Bear with me, you all, this one's long. C, a sterile dressing is used for surgical or deeper wounds requiring strict sterility, while a bandage is used to secure dressings or cover minor cuts, and home health aides may assist with bandages, but not sterile dressings unless directed. And then lastly, D, sterile dressings and bandages are the same, and home health aides are responsible for applying them without supervision. So, what is the difference between a sterile dressing and a Band-Aid or a bandage, and how does that relate to the role of a home health aide? And it looks like everybody got the answer right. I'm so proud of you. It is C. A sterile dressing is specifically used to cover surgical or deeper wounds. They were put on by the surgeon more than likely to prevent infection, requiring a clean and sterile environment for application, which typically falls under responsibilities of a licensed healthcare professional. Bandages, on the other hand, are used to secure sterile dressings or to cover minor cuts and abrasions, and a home health aide can assist with a bandage. Great job, team. All right, question number 6. What role does a home health aide play in colostomy bags? A, they cannot help with colostomy care. B, they only observe the colostomy care. C, they replace the colostomy appliance. Or D, they assist with changing the colostomy bag. And I'll give you 5 seconds for this one. And we're going all the way to 100. Let's see what you got. All right, revealing the answer in 3, 2, and I see some correct responses. They do assist with changing the colostomy bag. So yes, when you're in your classes in the state of Florida, the home health aide classes are 80 hours. And so yes, you'll be trained to assist with the colostomy care, emptying it, and also being taught how to change the colostomy bag and appliance in case of leakage. Question number 7. Can a home health aide give a rectal suppository? A, yes, for pain management. B, no, this task is beyond their role. C, yes, with supervision. D, yes, but only in emergencies. Think of what we've already discussed. Home health aide certification program. This is not a license, it's a certificate. Should they be going into someone's body to administer a medication? And now reveal the answer in 3, 2, and the response is no. Giving a rectal suppository is a medical procedure requiring licensed personnel. And let's see what our wonderful Elizabeth says. Oh, thank you so much. Congratulations. And I appreciate you all. And you all just motivate me to keep going. I've been where you are. So I became a nurse in 1999. And I just wish we had resources like this to help us study. So, and then I like the fact that you all enjoy studying, so it helps me to make these videos because you actually take the time to watch them. All right, question number 8. Is a home health aide allowed to give a tube feeding? All right, so you can take care of people from birth to the end of life. Okay, so from birth to 150, whatever the end of life is. And so you have to stop thinking, oh, you're only taking care of geriatrics. You could be taking care of a special needs kid. And so are you able to give a tube feeding? A, yes, with special training. B, no, this requires a nurse or therapist. C, yes, for children only. Or D, yes, under a physician's order. Revealing the answer in 3, 2, and no. Pretty much you're not doing anything internal, anything invasive. So tubal feeding requires advanced training and close supervision, which is beyond the aide's role. Question 9. Can a home health aide give insulin to a patient? And I think you get the gist of it by now as far as medications. A, yes, if trained. B, yes, but only to non-diabetic clients. Why would you give insulin to a non-diabetic? C, yes, under supervision. D, no, insulin administration is outside of their role. And because I know this one's super easy because you understand now some of the limitations of a home health aide, I'm revealing the correct response in 3, 2, and 1. No, you're not giving injections. You're not giving enemas. You're not doing anything internal, and you're not touching pills. So now we can get to some of the other care questions. What does a home health aide actually do? So, is it acceptable for a home health aide to cut a client's nails? A, yes, for all clients. B, no, it is not allowed. C, yes, except for diabetic patients. D, yes, if the aide has permission. Think safety. If you're a home health aide, can you clip your client's nails? And Susie and Nikisha, Pascal, Macinda, Stephanie, you all have it right. It is no. Cutting nails can cause injury, particularly for elderly and diabetic patients, and is outside the aide's role. Question 11. What is important for effective communication in a home care setting? A, courtesy, B, tact, C, listening, D, all of the above. Looks like Jesus and Birthday. Hi, Birthday. Stephanie and Hamdi. All of you all are saying all of the above, and you are correct. It is D. Effective communication requires courtesy, tact, and active listening to build trust with their clients. And Shalom, you're going to do wonderful with your courses in Massachusetts. Question 12. What is body language? Is it A, form of communication using the body, facial expressions, and eyes? B, a special language for the deaf? C, only used by doctors to interpret symptoms? Or D, the newest dance craze? And this one's super easy. Just because you know what body language means, I need you to work on it, especially when you're in front of your patients. And so body language is A. It's a key way to express feelings and emotions non-verbally. So if you're in front of a patient and your arms are folded or you take an aggressive stance, it doesn't matter what you say to that patient. The patient is looking at your body language. So be very careful. If you're nervous, if you don't know how to stand in front of a patient, maybe like put your hands, your thumbs in your pockets. You want to take a non-defensive mode. If you stand in front of somebody with your hands behind your back, as far as a patient's concerned, it looks as if you're hiding something or as if you're going to be attacking them. So you want to try to have a very neutral stance, and a good way to do so is just to have like a clipboard or something in your hand or a pen, some paper, and then that way it doesn't appear as if you're aggressive or threatening. Question 13. Before performing a procedure on a conscious patient, what should a home health aide do? A, inform the patient that the doctor ordered the procedure. B, explain what will be done. C, ask for the patient's permission. D, proceed without explanation to save time. Let's see. Looks like I have A's. I have B's. Birthday says C. Leonie says C. So great job, you all. It doesn't explaining what you're going to do without asking their permission. So, hey, Eunice, I'm going to walk you. Never. It's hello, Eunice. Is it okay if I take you for a walk today? Your doctor's ordered it. So I guess I have that wrong. So let me go back. I thought it would be ask the resident's permission, but it says explain what will be done. So I do apologize. Explaining procedure builds trust and ensures patient cooperation. So I guess I have that incorrectly. You would explain it and then ask their permission to do it. Question number 14. What should a home health aide do if they feel angry while working with a client? These clients are going to say some of the darndest things to you. And how do you respond? Is it A, tell the client how they feel? B, find out if others have felt the same way? C, pretend the client is someone they like? Or D, talk with the agency supervisor about the situation? Miss Nancy has not been nice to you, and you are now angry. And if you chose D, you need to express those feelings with your supervisor. So speaking with a supervisor helps address personal feelings professionally to ensure quality care. It may be the supervisor can speak to Miss Nancy, can speak with you so you all can come to common ground, or maybe you need to be reassigned to care for someone else so that your anger does not decrease the quality of care that you provide. Question 15. Which of the following is the best way for a home health aide to ensure the client's home is safe from falls? Is it A, rearrange furniture to create more space? B, encourage the client to wear socks on smooth floors? C, remove clutter and ensure adequate lighting? D, place area rugs to cover slippery surfaces. And if you feel that you're doing better with the test because I am reading it to you, do not forget that for pretty much any high stakes exam, you can request an audio examination. In other words, they can give you headphones where the test will be read to you, or you can ask for the test to be read to you. Just depends on the test that you're taking. So sometimes people do have language barriers that they would be able to overcome if the test was read to them. So everybody, question 15, if you chose C, you are absolutely correct because clutter-free spaces and adequate lighting reduce the risk of falls, especially for clients with mobility issues and poor vision. So, and if you just go into a person's house and you rearrange their furniture, they sometimes have counted the steps, so they know how many steps it takes to get to the light switch. And if now you've moved furniture, they can hit their toe on the way to the light switch. So don't rearrange their furniture without letting them know that you've done so. Question 16. What is the first step a home health aide should take when identifying a frayed, that means the wire is sticking out, electrical cord in a client's home? A, tape the cord to temporarily fix the issue. B, advise the client to replace the cord. C, avoid using the appliance but leave it plugged in. D, unplug the appliance and report it immediately. What is the safest option for your client? And we'll reveal the answer in 5, 4, 3, 2, and everybody got it right. It is D. You're going to unplug the appliance. Frayed electrical cords pose a fire and electrocution hazard. The home health aide should unplug the appliance to eliminate the immediate risk and report the issue to the client, family, and or supervisor. Don't do any temporary fixes. Question 17. Which of the following is an appropriate action for a home health aide to take to prevent poisoning in the home? A, store cleaning supplies under the sink for easy access. B, label all medications and cleaning products clearly. C, keep medications and toxic substances out of reach or in locked cabinets. D, mix cleaning agents to make them more effective. What you do in your own house when you're cleaning and you mix the comment with the bleach, please don't do that in your client's house. You're going to make them pass out. So no mixing of chemicals. So it's definitely not D. We're revealing the correct response in 3, 2, and it is C. Great job, Dion, Bertha, Zenobia, Innocent, and Leonie. And I know there's a lot of you all who chose C. So if I didn't say your name, it's just because the chat is moving faster. But home health aides should ensure that all medications, cleaning products, and other toxic substances are stored safely out of reach. So we're just not worried about your client. They could have visitors, they could have kids, they can have pets that may come into the home. So you are trying to protect everybody. Question 18. When assisting a client who uses oxygen, which safety practice is most important for the home health aide to follow? A, keep the oxygen tank near an open flame. B, ensure the client's home has fire alarms and extinguishers. C, allow smoking only in well-ventilated areas. Or D, use petroleum-based products near the oxygen equipment. And this one's super easy, so I'll reveal the answer in 3, 2, and we're trying to prevent a fire. So we're going to do B. We're going to ensure that the client's home has smoke alarms and extinguishers because oxygen increases the risk of fires. So Usually there are going to be no smoking signs if a person does, if they are receiving oxygen therapy, and you should help the patient reinforce that. The patient should be aware of it. It may be the visitors who come to the home who may try to light a cigarette, and you want to let them know that that's not allowed because of the oxygen that's in use. Question 19. What should a home health aide do if they find the client's walkway covered in ice during the winter? All right, I'm a Florida girl, so I probably wouldn't go outside. But that's not the case if you're a home health aide who lives in a cold area. You're going to go to work. So is it A, ignore it since it's not part of their job? B, notify the client and suggest staying indoors? C, call a professional snow removing service immediately? Or D, salt or sand the area if supplies are available? And I know this one's tricky. I wanted to call a professional too. And so, yes, you all, I don't see anyone choosing the answer that I have here. It's going to be because you have to get to the house safely. It's going to be, and that should say D. It is not C. It should be salt or sand the area if the supplies are available. And the reason why you're doing that is because you have to make sure that it's safe for you to approach. So home health aides can take immediate action such as salting or sanding icy areas to reduce falls for clients and themselves. While it's important to notify the client and take precautions, those actions should be taken to address immediate safety concerns. So while you're waiting for someone to come, like a professional snow service, what's happening inside with your client? And are you going to be sitting outside in freezing weather with snow while you're waiting for this professional service to come? So if you're living up north and you have more input that you would like to add, you can put it in the chat now. But most people, especially if you're up north, you're used to dealing with the snow, and your clients need to be seen regardless. Question number 20. How should a home health aide handle a situation where the client's pet seems aggressive? A, request that the pet be secured in another room. B, attempt to calm the pet by petting it. C, ignore the pet and focus on the client. D, avoid going into the client's home until the pet is removed. And so remember, we do not pet animals that we are not familiar with. We'll be putting ourselves at risk of getting bitten or scratched. So B would not be the response. So if you're an animal lover and this animal seems aggressive, you just want to show that you're friendly and you go up and pet it and you get scratched or you get bitten, well, your company's insurance company, the workers' comp, may not cover you. So instead of you petting the animal, give me another option. Revealing the correct response in 5, 4, 3, 2, and yes, you all have it. You're going to ask Mrs. Gertrude to put her wonderful cat into a room until you can finish her care. So for safety, the home health aide should ask that aggressive pets be secured to prevent potential bites or harm. Ignoring the pet or attempting to calm it could escalate the situation, and avoiding the home without attempting a solution could lead to neglect of the client's care. So you're going to ask her to put the animal away until you can finish your visit. Question 21. What should a home health aide do if they suspect that the client's pet is being neglected? So here it is. You're trying to take care of Mrs. Gertrude, who is 80, and she's barely feeding her cat. Is it going to be A, ignore the situation as this is not part of your duties? B, take the pet to a local animal shelter? C, provide care for the pet without informing anyone? Or D, report the concern to your supervisor? Yes, Bertha. Yes, Stephanie. Teray, Innocent, Chrissy, Rose, you have it correct. You have to report that. It's going to be D. While caring for the pet is not the home health aide's primary responsibility, neglect may indicate a larger issue with the client's well being. So, reporting the current concerns to a supervisor ensures proper steps are taken to address the situation legally and ethically. And if you're like, oh, I'm just going to go to the store and buy some pet food for the animal, what happens when you're no longer responsible for that person? You change jobs, or if you're off for a week on vacation. So you have to let someone else know. Question 22. When assisting a client with ambulation, what is the most important safety practice? Is it A, walk behind the client in case they fall backward? B, encourage the client to move quickly to maintain momentum? C, use a gait belt and walk beside the client for support? D, hold the client's arm tightly for added stability? And if you've watched any of my other videos, you're going to get this answer right. So we're revealing the correct response in 3, 2, and yes, we're going to use that stabilizing equipment. We're going to use a gait belt. A gait belt provides control, assistance, and stability while allowing a home health aide to support the client safely. Walking beside the client ensures the aide can quickly respond to prevent a fall. Holding the arm tightly, like what you see us do in the hospital, that's not good because they're still going to fall and you're just holding the arm. That is not the best way. It does not provide support and the person may still be unstable. But whenever you have that gait belt around their waist, you get to control most of their body from their core. And if they are starting to fall, you pull them towards you and you would kind of break their fall because now that they're against your body, they can slide down your leg. So using the gait belt is one of the best ways to walk and one of the safest ways to ambulate or walk a client. Question 23. If a client falls and appears uninjured, what should the home health aide do first? A, help the client back into a chair immediately. B, assess the client for injuries and call for help if needed. C, notify the client's family and wait for their instructions. D, document the incident and continue care as usual. And I'm so proud of you for studying with me on the holiday evening. I pray that all of you all have had a very wonderful Christmas day. If you don't celebrate Christmas, happy holidays to you. But regardless, I pray that you had a great day, nevertheless. So whether you celebrate Christmas or not, it's just a wonderful day to take time away, spend with the family, and give a gift or two. All right, so let's see what question 23 is. The answer is B. The first step is to assess for injuries before moving the client. Even if they appear uninjured, internal injuries could occur. So proper assessment and reporting to a supervisor or nurse ensure the client receives the appropriate care. And based upon your agency's protocol, you might not be the one who assists the person back up. It may be mandatory that you call the ambulance, 911, and then the ambulance comes in and does an assessment if the nurse cannot get there before the paramedics arrive. So you would follow your agency's protocol, but don't move them without notifying your supervisor first. All right, so question 24. What should a home health aide do if a client makes inappropriate sexual advances? Is it A, firmly state that the behavior is unacceptable and leave the home immediately? B, ignore the behavior to avoid confrontation? C, politely but clearly tell the client the behavior is making them uncomfortable and report it to their supervisor? D, confront the client and demand an apology. Unwanted sexual advances. And I'm revealing the correct response in 3, 2, And everybody has it right. It is C. So if a client makes inappropriate sexual advances, the home health aide should address the behavior immediately by clearly stating that it's inappropriate and it makes them feel uncomfortable. For example, you can say something such as, I feel uncomfortable with what you just said or did, and I need you to stop. After setting this boundary, the home health aide must report the incident to their supervisor as soon as possible to document the situation and determine the next steps. The next steps would, of course, include, if you don't feel comfortable returning to the home, would be that you would be reassigned to another patient. Nadij, yes, everybody, please say a prayer. Her test is tomorrow, so we are praying for you. Good luck in advance. All right, question 25. What is the home health aide's responsibility if they suspect elder abuse in the client's home? A, confront the suspected abuser directly. B, discuss the matter with the client and ask for confirmation. C, document their observations in the client's chart and take no further action. Or D, report suspicion to their supervisor or the proper authorities. All right, so Miss Betsy has a bruise on her cheek that wasn't there yesterday. And when you ask her about it, she kind of is hesitant. And I don't know how I got that bruise. What are you going to do? And the answer is D. That's right. We are mandatory reporters, you all. So home health aides are mandated and must report suspected abuse to their supervisors or the appropriate authorities. Confronting the abuser or seeking confirmation from the client could endanger the client or hinder the investigation. Question 26. What should a home health aide do if a patient accuses them of stealing $5? A, ask the other aides who care for the patient if they took the money. B, ask the client why they are being accused. C, offer to give the patient $5. Or D, notify the agency supervisor. And this one's so easy. I'm just going to reveal the answer right away. If someone is accusing you of something, notify your supervisor. You need to protect your certification, protect your license, because allegations of theft should be handled professionally by informing the agency supervisor to ensure proper investigation and resolution. When you have these patients who sometimes have cognitive issues, they may have set the money down somewhere and they become suspicious of you, even though you are not doing anything incorrectly. So don't take it to heart. Just notify your supervisor and be careful with those patients who are accusing you of things. Question 27. If you do not chart a task that you performed for a patient, what does it mean legally? A, it was still done, but it cannot be proven. B, it was not done. C, the patient is at fault for not reporting it. D, it does not matter legally. You did not chart the blood pressure. What does that mean legally? That's right, Pascal and Bertha and Mary. It means that you didn't do it. If you don't chart it, you have no proof that it was done. So the correct response is B, because in healthcare, uncharted tasks are legally considered as not being performed, emphasizing the importance of accurate documentation. And so if you all just check Google, there were like 16 healthcare workers who were documenting that they were doing task turning, giving medications, etc., that weren't being done. And the patient, when they went to the hospital, they died. And so now there are 16 healthcare workers, and I cannot remember the state, I apologize, who have warrants for their arrest. They were arrested. Some of them have been released, but now, of course, they falsified documentation. In that case, they actually said they did things that they didn't do. But if you don't document something that you actually did, well, that can come back to hunt you. So make sure that you document effectively. And if you haven't done so, please like the video, give us a thumbs up, and also subscribe to our channel. I think we have about 70 people on the live stream right now. So I'd enjoy if we got about 30 likes. I'd appreciate it so much. All right, so question number 28. If a patient has a new area of skin breakdown and the nurse is visiting in 2 days, what should the aide do? A, wait for the nurse to see it during her visit. B, take a picture and send it to the nurse. D, report it immediately to the supervisor. Or, C, report it immediately to the supervisor. Or D, apply a dressing without informing anyone. So the home health aide may come out maybe twice a week. The nurse may come out twice a week, but you all do not necessarily come out on the same days. So communication is important. And so for question 28, the correct response is C. You're going to pick up the phone and you are going to notify the nurse of this new skin issue. And you're going to make sure that you document it. That's going to prompt her, if she can't come out, to send another nurse out to that home more quickly. Question 29. What does a rapid pulse and shortness of breath usually indicate? Is it A, the patient is excited and does not need to be reported? B, normal changes that occur with aging? C, the patient is tired and need rest? D, a possible medical issue that should be reported to the nurse? Rapid pulse and shortness of breath. Revealing the correct response in 3, 2, and yes, there's only so much you can do in the home. This is going to be D, because a rapid pulse and shortness of breath can indicate serious health issues that must be reported promptly. And if you cannot get your nurse, your supervisor on the phone, you will call 911, and then you will, call the office to let them know that you called 911, but you're not going to delay care for your patient while you're waiting for a nurse to return the phone call. Question number 30. What should you do if a patient says that they haven't had a bowel movement in 3 days? This one is so easy. I'm just going to give you the answer. The answer is C. We're going to report that. Okay. So while you're there, you can try to give them some warm milk, maybe some prune juice, whatever they usually use that's a food or a liquid that's not a medication, to promote bowel movements while you're there. But you still need to go ahead and notify that nurse. So the answer is C, because changes in bowel habits should be reported to the nurse to ensure appropriate action is taken. And then you just make sure that if you're only coming out twice per week or whatever, that every time you come, you reassess their bowels. How are you urinating? When was the last time you had a bowel movement? Was it hard? And based off of those questions, you'd be reminding them, hey, drink some fluids. Did you order any prune juice? Things like that. Or did you eat any fiber one, some total cereal? Things with fiber, and if they have enough fluid, that would also promote bowel regularity. Question 31. What is the home health aide's role in medication administration? A, recording and reporting the patient's reaction to medications. B, adjusting the dosage of medications. C, handing out non-prescription medications. That'd be like Tylenol. D, changing medication schedules to fit the patient's routine. All right, so even though you don't give medications, let's say that this patient just left the doctor and got a new order for an antibiotic. What do you think your responsibility is? You're in the house with her. You're doing vital signs. You notice a change in her breathing. So your responsibility would be A, is going to be recording and reporting if they have any changes. So home health aides, although we don't administer medication or adjust medications, we can observe and report reactions. If something doesn't look right, get on that phone and notify that nurse. Question 32. When a patient complains of pain, what should the aide do first? Is it A, ask the patient to describe the pain, B, call the patient's doctor, C, offer the patient some warm tea, or D, change the patient's position? And I'll reveal the correct response in 5, 4, 3, 2, and if you chose A, which you all did, you are correct, because understand the nature and the severity of the pain helps to determine the next steps in care. Remember, this person, they're home, so more than likely they have Tylenol. And so if she says she has a headache and she has Tylenol in her cabinet, well, you wouldn't necessarily give her the pill individually, but you could go to the cabinet and give her the bottle of Tylenol and then look at the order and just remind her, hey, according to this order, you're supposed to take 2 of them. Can you go ahead and get 2 out now? Here's some water. And then you would monitor to see if the headache improved. If it didn't improve after giving the Tylenol, well, that is when you would go ahead and notify your nurse. All right, so question 33. What comment from a patient about new heart pills should concern the aide? A, the pills are very expensive. B, the pills are a different shape. C, I have a rash on my stomach since taking these pills. D, I can't have these pills unless I have cold water. Great job, team. I'm revealing the correct response in 5, 4, 3, 2, and yes, the rash, it is C. A rash may indicate an allergic reaction and should be reported immediately. The change in the size of the pills, it could be a different maker, a different manufacturer, but whenever you look at the medication leaflet that comes from the pharmacy, it will usually tell you the shape of the pill that was issued and also the color. So when in doubt, look at the leaflet. Sometimes your patients are not wrong. It's just that a different maker made the pill. So that's why the color or the size could change. Question 34. What should an aide do if a diabetic patient feels jittery and nervous? A, take their temperature. B, find out their next doctor's appointment. C, have them lie down in bed. D, give them a glass of orange juice. You're not in a hospital. You don't have a whole bunch of fancy equipment. Diabetic patient feels jittery. Revealing the answer in 3, 2, and you can give them some juice. And if the juice improves their symptoms or reduces their symptoms, we know that more than likely their blood sugar was low. So jitteriness in a diabetic patient can indicate low blood sugar, which can be treated with a quick source of glucose like orange juice. If you don't have orange juice, as long as it has a regular sugar in it, you can go ahead and give apple juice. You can give maybe some candy, and the jitteriness should actually start dissipating in about 2 to 3 minutes. They're going to start feeling better. They won't be as sweaty. And so if that were to work, your next action would be to give them some food because their blood sugar was lower than normal, and also notify your nurse. Question 35. When should a pulse rate be reported? A, if it's under 60 or above 100 beats per minute. B, if it's irregular. C, if the patient complains about it. D, never, because pulse changes are normal. E, all of the above except D. When should you report a pulse? This one's tricky. Revealing the correct response in 5, 4, 3, two, and I see one correct answer. It is birth, and also Mary. Yes, it is E, you all. So a pulse rate should always be reported if it's abnormal. So if it's less than 60, that's a bradycardia. If it's higher than 100, that would be tachycardia. If it's irregular, that means that that patient's heart is not beating at the same pace. It speeds up, it slows down. That means that they're at risk of developing blood clots that could travel. We call it atrial fibrillation. So an irregular pulse, a fast pulse, a slow pulse, or if the patient complains about their pulse, it's like, oh, it's beating really fast. I feel it in my chest. That should be something that you want to report right away. Question 36. How should you take the temperature of an unconscious patient? So you've been called in to take care of somebody who is end of life and they are not responsive. Their mouth is open, so you can't use a regular oral thermometer because with their mouth being open, they're a mouth breather, you won't get an accurate temperature. So is it going to be A, orally, B, rectally, or using another method? C, by estimating their body temperature. D, it isn't necessary to take their temperature because they're unconscious. What do you think the correct response is? An excellent job, team. I am so proud of you. You have it right. And we're not going to do anything invasive. We're not going to use rectal. But look at those other means. It could be maybe we're going to use a thermometer that goes into the ear, or we can use the one that scans the forehead, a thermal temperature. So all temperatures are unsafe for unconscious patients due to choking risk, but also sometimes their mouth is open and you will not get an accurate temperature. So that's when you're going to use those other methods. Question 37. What happens if you do not record a patient's vital signs? A, it's not important as long as you remember them. B, it is a legal and professional error. C, is fine unless the patient's condition changes. D, only the nurse is responsible for recording vital signs. All right, I see the correct responses. So you are absolutely right if you chose B. Proper recording ensures continuity, of care and legal compliance. Remember, if you didn't write it, we have no proof that it's done. Question 38. Where is 99.6 degrees Fahrenheit considered a normal body temperature? Is it A, axilla or the axillary area? That would be armpit. B, mouth. C, rectum. Or D, none of the above? So where would we expect to have a higher temperature, but it still would be in the normal range based on the body part? And I'll reveal the answer in 5, 4, 3, 2, and I see Nikisha stumped. And so everybody chose B. I see a lot of B's. Well, I'm going to teach you something different today. It is C. And I don't really expect you to know this because we rarely perform rectal temperatures. But the answer is C, rectal temperatures, because we're getting that internal, that core temperature that's not impacted by the environment, by the cold air in the room. They are typically higher than the regular readings. And so the rectal temperature is the most accurate, but it's usually a degree higher than the oral or the axillary readings. Question number 39. How long should you take a patient's pulse? Is it 15 seconds, 1 full minute, 5 seconds, or 2 minutes? Whenever your finger, your index and middle finger are on the pulse, we call that palpating. So how long would you palpate the pulse? Revealing the correct response in 3, 2, and yes, Chrissy, Leonie, Hareg, oh, Paul Dunn, Nikisha, Dan, great job. 1 full minute. So a full minute ensures an accurate measurement, especially if the pulse is irregular. Question number 40. When counting a patient's respirations, what is the best approach? A, ensure the patient is unaware you are counting. B, tell the patient to breathe deeply. C, ask the patient to sit up straight. D, count only for 15 seconds. And revealing the answer in 3, 2, and I see you all are torn between A, B, and C for this one. Well, it wouldn't be C because what if the patient is paralyzed and they can't sit up straight? So it wouldn't be C. And if you tell them to breathe deeply, you are causing them to change the way that they breathe. So the correct response, yes, is A. You're going to not even let them know that you're counting their respirations because you want their regular respiration without it being altered. So A, ensure the patient is unaware you are counting. So if you're taking your exam in the state of Florida for the respiration skill, you don't even say the word respiration. You say the term vital sign. You use a very broad term because awareness of observation can alter the client or patient's breathing patterns. They're going to control their breathing because they know that you are watching them. So you don't let them know what you're doing. It's like, hey, Nurse Eunice, I'm here to take your vital signs. Is that okay? And then you would hold the pulse in some instances, but you're only holding a pulse to trick me into thinking that you're counting my pulse rate. Meanwhile, you're focusing on my chest and my abdominal muscles, the way it moves, and you're counting my respiratory rate instead. Question 41. What is the most effective way to decrease the transfer of pathogens, aka germs? A, wearing gloves. B, cleaning surfaces regularly. C, hand washing. Or D, using hand sanitizer only. Your hands gonna be all sticky. So it's not D. Revealing the answer in 3, 2, and you have it right. It is C, hand washing. Hand washing is the most effective method for reducing pathogen transmission. And don't forget, hand sanitizer does not kill every pathogen. But if you use warm water and soap, if the soap doesn't kill the pathogen, you using friction in that warm water, it should wash the pathogen off of your hands, thus leaving your hands clean. Question 42. What is the best action for a home health aide to take if a client struggles with preparing meals and is unable to leave their home to buy groceries? A, purchase groceries for the client without notifying anyone. B, recommend the client enroll in a meal delivery program such as Meals on Wheels. C, encourage the client to cook with limited resources at home. D, inform the client that they need to ask a family member for help. Well, no, duh. They probably have already done D, and the family member is unable to help or unwilling to help. So, what is the best response? All right. And so, you all, there are resources for your clients. There are a lot of community resources. And so, if you can, you're going to advocate for your client and you're going to recommend B, that they use a meal delivery service such as Meals on Wheels. And then you're going to notify the nurse who's going to notify the case manager because we can't have these patients not eating. Okay. Improper nutrition is going to cause other health issues. So programs like Meals on Wheels provide nutritious meals for seniors and individuals with mobility challenges. The home health aide should connect the client to the appropriate resources rather than assuming responsibility for shopping or cooking. And what a lot of these clients will do is they will just go without, and that is not good. Question 43. Where should the catheter drainage bag be placed? A, higher than the bladder, B, on the floor, C, lower than the bladder, but not on the floor, D, at the same level as the bladder. And I'll reveal the answer in 5, 4, 3. I am so proud of you all. So many correct responses. It is C. Lower than the bladder, but not on the floor. And I like this image because it shows a leg bag. Remember, when you're taking care of someone at home, they may not have that large bag that you would see in a hospital setting. And so this one is more convenient. They can still walk with, they can get dressed, they can go to the store, and no one should know that they have a catheter because it's going to be concealed, it's strapped to their leg. But regardless, it should always be dependent. We don't want that urine back flowing. So it should be lower than the level of the bladder, but not touching the floor, because proper placement ensures urine flows correctly and prevents contamination. Question 44. When should you wash your hands during a home visit? A, after removing gloves. B, before providing care. C, after petting a dog. D, all of the above. That's right. I'm happy I'm teaching you this. If you see D, all of the above, more than likely that's the answer. So great job, team. It is D, all of the above. So hand hygiene is necessary after any activity that could introduce contamination. And as soon as you walk into that client's house, you are cleaning your hands because you're bringing those outside germs into their environment. So wash your hands upon entry and then after any other point of contact. And if the client doesn't have hand sanitizer, I would advise that you have some in the bag that you bring into the home. Question 45. A client expresses feelings of isolation and boredom. How can the home health aide best support the client? A, suggest the client join a senior community center to engage in social activities. B, take the client to visit friends and family during work hours. C, watch television with the client to pass time. D, tell the client that loneliness is common and unavoidable. And I will take multiple answers for this one. So whenever you're entering your response, tell me what 2 answers do you think are the most appropriate? I see a lot of A's. I see a C. Revealing the correct response in 5, 4, 3, 2, and Nikisha gonna be watching TV with the client, but I know they're gonna laugh, so she won't be bored for too long. And so even though the answer is A, I'll take C. I mean, if she's bored, watch TV with her. So senior community centers often provide opportunities for socialization, physical activities, and educational programs that can enhance the client's quality of life. But what if you have a client who maybe has social anxiety or who physically, because of their medical condition, can't leave the house to go to a senior center? So maybe you could watch TV with them. You can play games, maybe crossword puzzles. Just find a way to, provide more joy and more activity in their life. Question 46. Can diarrhea cause dehydration and other complications that require reporting? A, no, it's not a concern. B, yes, it can lead to dehydration and other serious complications. C, only if it lasts more than 3 days. Saying that caused me pain. I could not imagine having diarrhea for 3 days. D, only if the patient also has a fever. Thank you, Vera Hareg, 70, Leonie. Yes, Karen, it is B. Yes, dehydration can be caused by diarrhea. And also, that would, if they're having continuous bowel movements, they're going to be losing vitamins. They're going to potassium and minerals. So their potassium level may be low. It's going to cause a lot of electrolyte imbalances. So diarrhea can cause other complications besides dehydration due to the lack of vitamins and minerals. It can cause their heart to start beating abnormally. So report that diarrhea right away. Question 47. What is the most appropriate response if a client shares concerns about their sexual health with the home health aide? Look, you're in that house. They like you more than they like the nurse. They feel like you're their best friend. So, how would you respond? A, dismiss the conversation as inappropriate. B, report the conversation to the client's family immediately. C, provide medical advice based on a home health aide's experience. Or D, suggest they speak with their doctor or nurse. All right. Remember, when women become menopausal, they could have some dryness, some irritation. She's telling you about her sexual concerns. What do you think the best response is? If it's a male, maybe he has erectile dysfunction and you're already uncomfortable just listening to this. So I think the best response is going to be D. Have you talked to your nurse about this? She's really nice, and I'm sure that she can assist you with that matter. So, sexual health is a legitimate concern at any age, and home health aides should approach the topic with professionalism. While they cannot provide medical advice, they can encourage the client to discuss their concerns with a qualified healthcare provider. Question 48. Is it normal for people to complain of swelling, pressure, or bloating in their ankles, feet, stomach, or legs? A, yes, it's a normal part of aging. B, only in patients with diabetes. C, no, these symptoms may indicate a serious health issue. Or D, only if they are standing or walking for long periods. Is it normal? All right, waiting for a few more responses to come through. And looks like everybody has it right. So, swelling, pressure, bloating is not normal. However, it is C. That's the correct response. If that is happening, that is a sign that your client could have a worsening of a medical condition. So, fluid retention usually indicates heart failure. It could indicate kidney failure. So, you want to be notifying your nurse and you want to monitor it. So, you don't give medications as a home health aide, but what do you do about somebody who has heavy, swollen legs and feet? Well, you're going to encourage them to elevate. And then, if this is something that their physician or nurse has been made aware of, more than likely they're going to have those compression hose. You will remind them to put those hose on. That's going to decrease some of that swelling that's going into their legs. And don't forget to weigh them, because if they gain more than 3 pounds in a short period of time, that definitely means that they are retaining fluid and that their congestive heart failure is worsening. All right, so question number 49. What should you do if a patient's catheter is not draining? A, call your supervisor. B, empty the drainage bag. C, check the tubing to see if it's kinked. D, do nothing. This is the nurse's responsibility. Well, I already told y'all the nurse comes out on 2 days a week. So the nurse came on Monday and it's Wednesday. So are you going to wait for the nurse to come to say, hey, yeah, this drainage bag is not draining? So what do you think the best response is? What do you do while you're in the home? Yes, Kelly. Yes, Hareg and Nikisha and Chrissy. And I hope I pronounced that right. Common Suisse. It is C. You are going to check to see if the tubing is kinked. A kinked tube is a common cause of non-draining catheters, and it's appropriate for the nurse aide to check first. And so whenever you are checking something, you start off at the patient. You don't start off at the bag at the bottom. And so, for example, to be Mr. Harris, look, there appears as if your urine isn't draining in this bag. I have on gloves. Is it okay if I check your catheter? And you start with his penis. You start with the meatus and trace the tubing down to make sure there are no kinks, that nothing is maybe kinked beneath his leg, to make sure everything is free flowing. And then once you release any kinks that are found, the urine should begin to flow. If it doesn't flow, that is when you're going to be on that phone notifying your nurse, because it could be maybe a blockage, a kidney stone, maybe it's kinked inside of the bladder. That'll be a reason for that nurse to come out and evaluate more. Question 50. Which of the following is not recommended for promoting daily bowel habits? A, plenty of water. B, laxatives. C, exercise. Or D, well-balanced meals. And if you've been here this long and you haven't hit that like button, remember it's Christmas. Give me the gift of a like, a thumbs up, if you will. And so we're revealing the answer in 3, 2, and it is laxatives. It is B. They should not be taking laxatives all the time. So laxatives should not be used daily, as they can disrupt natural bowel function. And Merry Christmas to you too also, Kelly. All right, question 50. We're halfway down. We're going all the way to 100. And I'm so proud of you all for sticking with us this long. What should you do if a patient's pulse suddenly drops to 58 beats per minute after consistently being between 90 and 110? A, tell the patient he must be getting better. B, wait 15 minutes and then take the pulse again. C, inform the supervisor right away. D, record the pulse and proceed with the visit. So far, I see 2 correct responses. So I reveal the answer in 3, 2, and you all, that was a significant drop. He went from normal to below normal. Get on the phone, call that supervisor, because more than likely his medications that he took, maybe he's taken too many of them. Maybe he took too many pain pills. Something's not right. There's no reason for your pulse to drop to be at 90 consistently and then drop to 58 without there being a medical reason behind it. So a sudden significant change in the pulse may indicate a serious condition and must be reported immediately. Question 51. What should the home health aide do if the client asks to be driven to a doctor's appointment, but the home health aide has allowed her auto insurance to lapse? Ooh, girl, you're going to have a rough day. Is it A, drive the client anyway to ensure that they get to their appointment? B, notify the supervisor immediately and suggest alternative transportation options? C, borrow a friend's car and take the client to the appointment? Or D, ask the client to reschedule the appointment until the insurance is reinstated? Now, how are you a home health aide with a lapsed auto insurance policy? How are you getting from point A to point B? So the correct response is you got to tell somebody, because your client depends on you for transportation. The correct response is B. So some of these agencies require the home health aide to transport the client, whether they're going to the hair salon, the nail salon, going out to eat. So you're not always just going to have a client who's just going to be homebound. They have to come out the house, and you would be that person who goes with them. So driving without auto insurance is illegal and unsafe. The home health aide should promptly notify their supervisor about the situation to ensure that the client receives assistance and does not miss their appointment. Question 52, true or false? Excuse me. It's just two responses, yes or no. Does a bedside call bell need to be available for a bed-bound patient? A, yes, always. B, no, unless the patient asks for one. So even if your patient is paralyzed, unable to move their hand, do you need to provide them with a call bell? Yes or no? That is right, Karen and Dion. And yes, Zenobia. Well, Zenobia, that's not right. The answer is always yes. Your patient should always have a way to call you. They don't need to ask for the call bell. Your job is to make sure they have a way to call you. And so, for those patients who have special concerns, like if they are paralyzed or they're quadriplegic, they actually have straw-like devices that you would attach to the bed. And if they blow into the straw, because usually they can still move their head. So if they blow into the straw, that would activate the call system. And then, of course, a staff member would be notified to come into the room. But there should always be a means by which your patients, your clients should be able to call for assistance. Question number 53. Should bed rails be used to secure vest restraints? Yes, A is yes, is standard practice. B, no, bed rails should never be used this way. And if you don't know what a vest restraint is, I'll show you on the next slide. Vest restraints we don't use any longer because your patients are Houdinis and they will slide out of the vest restraint, or it would end up being around their neck, causing a strangulation hazard. So should any type of restraint be attached to the bed rail? And revealing the answer in 3, 2, and you all have it. Absolutely not. It is B. So using bed rails to secure restraints can lead to injury and it's not a safe practice. So you all, this was a vest restraint. This, when I was a nurse way back in the day, a new nurse, we used these all the time. And your patient would just slide down to the foot of the bed and that vest would end up around their neck. So you rarely see these in practice. But regardless of the type of restraint, they are usually going to be attached to the hooks or the holes that are beneath the bed on the frame, and that's the safest place to secure them. You don't want to attach it to a side rail or a bed rail because when you lower the bed rail, you could possibly injure your patient. Question 54. Is it okay for alert patients to smoke in bed? Miss Dolly is wide awake and she's like, hey, I'm ready to take my smoke break. I'm just going to smoke right here in this bed. A, yes, if they are not confused. B, no, smoking in bed is never safe. And I can't trick you all. I see all the correct responses. No, because she may fall asleep. So the correct response is B. Smoking in bed is a significant fire hazard and should never be allowed. Question 56. What are part of your duties to ensure a safe home environment? A, proper hand washing and infection control. B, electrical and fire safety. C, removing hazards that may cause the patient to fall. Or D, all of the above. So when you are in someone's house, you have a lot of responsibilities. So if for question 56, you chose D, you are an excellent caregiver because safety involves multiple factors, including hygiene, fire prevention, and reducing fall risk. Question 57, what safety precautions should be taken for a patient using oxygen? Is it A, keep the TV set at least 5 feet from the oxygen tank? B, do not permit the patient to drink soda. C, allow no smoking in the patient's room. D, do not use lotions containing oil in the patient's room. What is the safest response that's going to prevent a fire emergency? And if you chose C, you are right because oxygen is highly flammable and smoking near it poses a serious risk. Question 58. What should you do for an injury with profuse bleeding? Okay, so that means that's heavy bleeding. A, apply pressure and call for assistance. B, wrap the injury loosely and monitor. C, clean the wound with alcohol, ouch, and bandage it. D, call the nurse and wait for instructions. So your patient has blood, just they cut themselves and there is blood just pouring out of their arm. What is the best response? And so for this one, it is not D, because while you took the time to rush to go get the phone to call the nurse, your patient is losing blood. I need for you to do A. You're going to apply direct pressure. And then once you can get that bleeding under control, or maybe with the hand that you're not using to apply pressure, you can call your supervisor or 911 with your other hand. But applying pressure and preventing blood loss right now is your priority until more help arrives. Question 59. What is your responsibility when a patient has a seizure? A, call 911 immediately. B, hold the patient still to stop the seizure. C, prevent the patient from injuring themselves. D, place a spoon in the patient's mouth to prevent biting. All right, so you're taking care of a kid in the home care setting, and this kid has epilepsy. This isn't a new issue. This is something they've had for a while. This kid is seizing. What is your priority? Yes, T. Yes, Leonie. Yes, Chrissy. Yes, 7A. We're going to try to prevent them from injuring themselves. So we're going to move objects out of the way. If their head is hitting the ground, put a pillow, purse, coat, put something beneath their head. And then if you're thinking they may vomit, you can turn them to their side during the seizure. If not, once the seizure activity ends, that's when you can turn them to the side. And whenever you have a client who has a history of seizures, epilepsy, remember to always try to time what time the seizure starts, because based on the length of the seizure, the time that the child is actually seizing, that will determine whether or not 911 needs to be called. Question 60. What should you do if a patient falls and complains of hip pain? A, help the patient up and assist them to a chair. B, leave the patient and call the supervisor. C, encourage the patient to move their hip to check for pain. D, call for help and avoid moving the patient. All right, revealing the answer in 3, 2, and yes, Rose, yes, Mary, yes, Bertha, yes, Sebony, yes, Sebony, Nikisha, you have it. It is D. All right, so this patient is on the floor. They hurt themselves. Don't get them up. Above your pay grade. Alert, alert is D, because moving a patient with potential hip injury can worsen the situation. Look, we're calling 911, team lift. They're on the floor in the home. They need to go to the hospital. They need an x-ray. So it's not much you can do except for document, call 911, and notify the supervisor or the nurse at the home care agency. Question 61. What should, and of course, keep your patient calm and, support them until the rescue team arrives. Question 61. What should you check before performing first aid on a choking patient? A, if the patient can drink a sip of water. B, the patient's pulse rate. C, if the patient is assigned to you. D, if the patient can speak or cough. Let's see. What do you think, team? I have a lot of D's. Look like the D's have it. And you are correct. It is D. Look, when you're in these facilities, whether it's a nursing home, a group home, you could be in an assisted living facility that's home-based. where there are 6 clients there, unfortunately, everybody is your patient if someone is having an emergency. So whether they are assigned to you or not is a non-factor. But what you would be concerned about is whether or not the patient can speak or cough. Because if they can't speak or cough, that is when you are going to jump into action and you are going to be performing the abdominal thrust, previously referred to as the Heimlich maneuver. If they can cough, you're going to encourage them to keep coughing because that is a mild obstruction. It is not a total obstruction. Question 62. What should you do if a patient becomes unresponsive during a bath? A, call the supervisor immediately. B, lower the patient to the floor, call for help, and begin CPR if necessary. C, ask a family member to call 911 while you continue the bath. Or D, wait for the family to arrive before taking action. If you do D, we're going to see you on the news. And we really liked you. We don't want to see you on the news for neglect. So you're not going to wait before you take action. So give me the best response that's the safest for your patient who just became unresponsive while you were about to give them a bath. All right. So the best response is going to be B, get them to the floor. And so if this is somebody you're already concerned about, when you're in these people's homes, keep your cell phone on you. Keep it on you. Keep it in your pocket. That way you can call from help while you're in the bathroom with this particular client, because immediate action is required in life-threatening emergencies. Question 63. For which emergency is knowledge of pressure points essential? Think first aid, you all. Why do you need to know about pressure points? Is it A, bleeding, B, burns, C, heart attack, or D, food poisoning? Now I'm going to take a sip of water because looks like I've been talking now for how long? An hour and 30 minutes. I'm so proud of you because some of y'all have been there with for this video from the beginning. So great job, team. All right, so why do you need to know about pressure points? Because if you press on them, you slow down a bleeding. So applying pressure to specific points can help control severe bleeding. So if someone is bleeding from their hand or near their wrist, if you press hard on the radial artery, that's going to slow the bleeding. Don't forget to elevate the extremity. You can also press on the brachial artery, elevate the extremity. That would slow down blood loss. Let's say that someone had an injury to their leg. You would press on the femoral artery, okay? And that would slow down the bleeding in that area. So pressure points and knowing where they are really important. Pretty much if you can put your finger there and feel a pulse, if a person is bleeding below that area, you would want to press on the highest pressure point in order to control or slow down bleeding if they do have an injury. Question 64, which phone number must the nurse aide keep near the phone? We're talking about the client's phone. You're in their home. What number do you keep near their phone? A, the emergency medical team. B, the patient's clergyman. C, the next door neighbor. Or D, the pharmacy. And most of your patients are going to have something on their refrigerator, something near their, a very common area that lists probably all of this information. But for the purpose of this practice test, which number is the most important for you as a home health aide? And if you chose A, that is right. It's going to have the case manager, the nurse. You need the information to the agency. You need that information because quick access to emergency services is critical in a patient's home. We will call 911 only in cases of a severe emergency. Outside of that, that nurse and that home care team should be coming in if you call. All right. So question number 65. What is the most likely impact on the client if a home health aide calls out at the last minute without proper notification? A, the agency will assign another aide immediately without issue. B, the client's family will automatically take over care responsibilities. C, the client will be unaffected since they can manage independently. Or D, the client may miss essential care and face potential harm because you called out at the last minute. Don't do your clients like that. You have to be consistent and dependable if you're going to be in home care. So everybody, the correct response is D. That is it. Last minute call outs can disrupt care plans, leaving clients without essential services. The doctor has only ordered a home health aide to come out to see this client once per week to help with a bath. The agency only has 3 home health aides and everybody's booked this week and you call out. That means that that client will go a week without a bath if they can't get anyone else in that site. So you could negatively impact their health and their well-being by calling out. So we understand if you're sick, but if you're not sick, try to go and see your clients. Question 66. Can you use a patient's items for their care without asking? Oh, Miss Nancy has lotion over there, and I need this lotion because I just gave her a bath. A, yes, if it's for their personal care. B, yes, if the patient is asleep. C, no, permission is always required. D, no, unless directed by the supervisor. Remember, you are a guest in their home. Can you just go and use their items without asking? That is right, Mary and Leonie. No, you're always going to ask permission. Don't just start going going in their cabinets in their closet. Hey, I see you have some shaving cream in here. Get their permission first. Get their permission before you even open up the closet door. No permission is always required. Respecting the patient's property is essential in maintaining trust and professionalism. Question 67. What should a home health aide do if they start feeling sick while providing care to a client? So you're in this client's home and now you feel nauseated and you feel like you're about to have a diarrhea episode. A, continue providing care until your shift ends. B, immediately leave the client and go home. C, notify the supervisor and follow instructions for handling the situation. D, take over-the-counter medication and finish the shift. I know we try to be soldiers, and we're probably going to do D. But if you don't leave that patient's house, the patient probably won't ever want you to come back when you get through vomiting and having bowel movement everywhere. So I need for you to get out of their house. So the answer is going to be C. That is right, Jesus. If a home health aide feels unwell, especially if there is a risk of transmitting illness to the client, they must inform their supervisor immediately. The supervisor will provide guidance to ensure the client's safety while addressing the home health aide's concerns. Question 68. What does stealing time mean in the context of a home health aide's responsibilities? A, taking longer breaks than allowed. B, clocking in or out at inaccurate times to manipulate pay. C, spending personal time on the phone while with the client. Or D, all of the above. Don't get caught stealing time. You may have to pay back that money and you could be charged with a crime. Because stealing time refers to, yes, AJ, all of the above. Look, I hate to see my nurse and my CNA and my home health aide buddies in handcuffs, but stealing time involves dishonesty. You're manipulating work hours or engaging in non-work related activities during paid time. This unethical behavior can lead to disciplinary action or legal consequences for the home health aide. Question 69. When working with a patient who is disabled, the general goal of care is to A, provide constant supervision, B, provide total care, C, promote maximum self-care and independence within the limits of the person's ability, or D, promote the complete return of the person's abilities. And we only have 31 more questions to go. You all are so awesome. And I'll reveal the answer in 3, 2, and it is C. You want to promote the maximum self-care. You want to encourage independence. Encouraging independence preserves dignity and helps the patient maintain as much autonomy, decision-making abilities as possible. Question 70. All right, this one's long. Let me try to see if my eyes can read it. It is Mrs. Amos's usual time for lunch, but she says she is not hungry yet. This is the first time that Mrs. Amos has made this type of statement. What should a home health aide do? A. Insist that Mrs. Amos eat at this time. B. Tell Mrs. Amos to let the aide know when she wants to eat and remind her that it is important that she still have lunch. C. Tell Mrs. Amos that if she does not eat by herself, she will have to be fed. Or D. Tell Mrs. Amos that it took a lot of time to prepare the food and that she should eat it while it's fresh. All right, revealing the answer in 3, 2, and yes, it is B. Respecting the patient's preferences while gently reminding them of the importance of nutrition helps to maintain trust and collaboration. Question 71. The ability to make observations is even more important when working with infants and young children than it is when working with adults. The chief reason for this is that infants and young children, A, do not like to be told what to do, B, are usually sicker than adults, C, enjoy human contact more than adults, D, cannot explain how they feel. Why are your observations important? I know this one's tricky because some of you all don't think about working with children and infants, but you can work anywhere there's a nurse. And so the reason why your observations are going to be important is because D, they can't explain what's wrong with them. So if you see that a child is more sleepy than they normally are, well, that can be a sign that something is wrong with them, that they're sick. They're usually happy, interactive, asking a whole bunch of questions, and today they're in their bed asleep. You may want to notify the nurse because infants and young children are usually unable to verbalize their symptoms of needs. So your observation is crucial to identify any issues. Question 72. During a bed bath, what part of the patient should remain uncovered? A, the entire body. B, only the part being washed. C, arms and legs. D, head and chest. All right, revealing the answer in 5, 4, 3, 2, and I see the correct responses. It is B. Only the part being washed. So you don't want to overexpose your residents. So keeping the patient covered except for the area being clean preserves warmth and dignity. So for example, on the perinatal care video that I have there, I have the gown up to only expose the private area. And then I have the bedding, the sheet, the blanket up to the upper thigh. So the only thing that's being exposed is the area that I am cleaning in that immediate moment. So wash it, rinse it, dry it, and when you're done, you cover it back up. And so if you want to see our full list of our CNA, caregiver, home health aide clinical skills videos, we have a playlist on YouTube, and how you access it is going to our website, fltraining.com, and you're going to see a CNA training video list. Just click on that and it will take you directly to the skills playlist. Question 73. What are the legal implications of falsifying documentation as a home health aide? A, it is considered fraud and can result in termination, fines, or imprisonment. B, it is a minor infraction and carries no legal consequences. C, it only affects the home health aide's reputation, but is not legally actionable. D, it is permissible if the client is satisfied with the care. I've heard stories of home health aides. I guess the time tracking device. As long as you're at the patient's address, you can sign in as if you're actually there on the clock, and the home health aide or the CNA would just pull up in a patient's driveway, sign in, and then back out and leave without ever performing care. And so that would be A. Falsifying documentation such as recording services that were not provided is a serious offense that constitutes fraud. It can lead to legal consequences, including fines, loss of certification or license, or even criminal charges, because in a case recently, a home care client died, but the CNA was documenting that she was there providing care, which was inaccurate. Question 74. When cleaning a patient after a bowel movement, what is the correct technique? A, back to front. B, circular. C, front to back. D, random motion. Do a zigzag. Do whatever you want. Just clean it off. Don't do D. All right, so I'm revealing the answer in 5, 4, 3, 2, and yes, everybody, we clean from the cleanest towards the dirtiest. So the answer is C. We're always going to clean front to back because that prevents from spreading bacteria to other areas. In other words, it prevents you from taking fecal matter and bringing it to the vaginal area. Or for a man, if you start with his buttocks or his rectum first, you'll be taking the fecal matter and then bringing it towards the tip of his penis. So we always want to start with the cleanest area, whether it's the penis or the vagina, and then work your way down, front to back. Question 75. What is the best practice for elderly skin care? A, use scented soaps. B, apply alcohol on the skin. C, keep the skin clean and moisturized. D, wash skin only weekly. All right, it's super easy question, revealing in 3, 2, and yes, team, it is C. Keep the skin moisturized and clean because proper cleaning and moisturization maintains skin health, prevent dryness, prevents bed sores. Remember, if the skin is dry and it starts getting irritated, it can open up. So that can actually start a bed sore too. And so again, we have those clinical skills videos. Go to fltraining.com if you would like to see some of our caregiver videos. Question 76. Where should dentures be stored when not in use? A, in a washcloth. B, in clean water in a container. C, wrapped in gauze. Or D, on a dry surface. And there's no reason for any of you all to answer this one incorrectly. Dentures are expensive. Where do you want to place these $10,000 prostheses, these fake teeth? All right, revealing the answer in 3, 2, and that is right, Nikisha. We're going to put it in a cup of clean water, a container. So we're going to have our denture cup. So the answer is B, because keeping dentures in water prevents them from drying out or becoming damaged, and keeping them in that container provides extra protection. Question 77. If a client with diabetes consistently skips meals, what is the most appropriate action for the home health aide to take? A, encourage small, frequent snacks and notify the supervisor. B, prepare sugary drinks to keep their energy up. C, let the client skip meals and monitor for changes. D, offer to replace meals with high-calorie shakes. Oh, Lord, I would love a milkshake right now. So revealing the answer in 5, 4, 3, 2, and yes. Look, I understand that you may not be hungry now, but because you're a diabetic, we have to keep your blood sugars level, okay, stable. So we need you to do A. Skipping meals can lead to dangerous blood sugar fluctuations. Home health aides should encourage the client to consume small, frequent snacks to maintain their blood sugar levels, and they have to report the behavior to the supervisor for proper follow-up. Question 78. Which nutrient is most essential for wound healing in clients with bed sores? Is it zinc, potassium, protein, or vitamin D? What does a patient with a bed sore need most? All right, you all, revealing the answer in 3, 2, and I think I only see one correct response so far. You all see protein. So protein is critical for tissue repair and wound healing, making it essential for clients with bed sores. So think about the bed sores. Think about the muscles. The muscles are deteriorating. That's why that sore was able to like open up, especially when it gets really deep. And so making sure that when they're eating their meals that they actually are consuming some protein, even if they're a vegetarian. Peanuts, peanut butter, different beans, those actually have proteins in them also. Even though I know someone was choosing zinc and vitamin C, they do play supportive roles, but protein is the foundation of cellular repair and regeneration, and that is what's needed in order to help prevent those bed sores and to heal the bed sore that the patient currently has. Question 79. What is safe foot care for a diabetic patient? A, soak feet for over 5 minutes. B, clean under toenails. C, cut toenails carefully. D, apply lotion after drying, avoiding the area between the toes. Revealing the answer in 3, 2, and I know this one's tricky. 70 has it. So whenever you are providing foot care, everybody, you're not supposed to be cutting anything. You're not cleaning beneath your toenails. That is a job for a podiatrist, not for a home health aide or a CNA. But what you are going to do is when you get through washing their feet, you are going to wash the entire foot, including between the toes. You're going to dry the foot, including between the toes. But when you apply lotion, you do not apply lotion between the toes, because if you do so, you will help fungi grow because they like dark, wet places. So, especially for the Florida Prometric CNA examination, no lotion between the toes. In the real world, consider that also. Question 80. When transferring a patient, which side should they move toward? The weaker side, the stronger side, the side that is easiest for the aide, or the closest side to the chair? Your patient has a weaker side, and now they need to move. Which way do they move? Yes, Chrissy, I see it. You're going to have them move toward their stronger side. So transferring toward the stronger side provides better stability and safety. So Mrs. Mitchell, would you scoot towards me? All right, this is the stronger side. That's the side that she leads with. Question number 81. What are the potential causes of bleeding gums in a home care client? Is it A, poor oral hygiene leading to gum disease? B, vitamin C or K deficiency? C, the use of certain medications such as blood thinners? Or D, all of the above? All right, so your client was brushing her teeth, and when she rinsed, you saw like some reddish drainage, blood tinged drainage from her mouth, which prompted you to check, and you see that her gums are bleeding. What would be a likely cause? And yes, it is D, all of the above. Bleeding gums can result from several factors. Poor oral hygiene can lead to plaque buildup, causing gum disease. Nutritional deficiencies, such as the lack of vitamin C or K, can weaken gum health and impair clotting. And also, medications like blood thinners, even a baby aspirin, can increase the risk of bleeding, even with minor trauma to the gums. Question 82. What is the best tool for helping unsteady patients? Is it a wheelchair, a walker, a cane, a gait belt, or the tool recommended by the physical therapist based on the care plan? All right, so you go into your client's house and they just have every piece of equipment available. Don't get tricked. How do you know what equipment to use? Yes, everybody. I'm going to be revealing the answer in 3, 2, and I need you to read the plan of care. It is E, because I have all this equipment because we do training. And so I can just imagine when I get older, I'm just going to have all this equipment just hanging around. And you will be so confused when you walked into my house because you're like, hey, she got walker, wheelchairs, canes, they even have crutches. You need to read the plan of care. So the best tool for assisting an unsteady patient depends on the individual's specific needs as outlined in their care plan. Physical therapists evaluate the patient's mobility, balance, and strength to recommend the most appropriate tool, whether it's a walker, cane, gait belt, or wheelchair. So I know what the patient wants, but I need for you to at least look at that plan of care to make sure you're giving the care that usually a physical therapist is a doctor, that the doctor ordered. And if there's any deviation, make sure you let your nurse be made aware. Question 83. How should a patient move up in bed? So this patient is able to assist. Is it A, push with their heels and flex their knees? B, arc their back? C, separate their legs widely? Or D, raise themselves on their elbows? All right, revealing the answer in 3, 2, and that's right, Immaculate. You are, I'm sorry, it's Chrissy, not Immaculate. So Chrissy, you have it. We're going to have them push with their heels and flex their knees. So you're going to say, all right, let's go ahead and bend your knees and push up towards the top of the bed. Having them use their elbows. What if they're like 300 pounds? Imagine somebody who's 300 pounds putting all that pressure on their elbows while their legs are straight, trying to get up to the top of the bed. So the easiest thing is to have them use those core muscles, those large muscles, to help push themselves towards the top of the bed, because this technique uses a patient's strength to assist in repositioning. The elbows are simply not as strong as their legs are. All right, question 84. What is the primary role of a social worker in a home care setting? A, teaching the client's physical exercises. B, monitoring the client's vital signs. C, assisting the client and family with assessing community resources and emotional support. Or D, preparing a nutritional meal for the client. So another word for social worker, or another term, is case manager. So you may hear the term case manager more frequently than social worker. All right, revealing the answer in 3, 2, and everybody got it right. It is C. So social workers connect clients and their families to resources such as financial assistance, counseling, or housing. They provide emotional support to help families cope with the challenges of caregiving. Meal planning, vital sign monitoring, and physical exercises are the role of other professionals. Question 85. What is the role of the registered nurse RN in home care? Is it A, administering medications, managing wound care, and monitoring the client's health status? B, conducting physical therapy sessions? C, performing house cleaning tasks? Or D, assisting with mobility exercises? So you all, the last time I worked in home care, I was helping with a 3-year-old wonderful little boy. He was so busy. I spent the whole day, 12 hours, chasing him around a house. He would not sit still. Cleaning up, I had to clean the house up multiple times because he was allowed to just throw everything everywhere. And so if you don't want that much fun, deal with mature people. Don't deal with the kids, because the kids are going to really have you working for 12 hours, depending on the type of client that you have. And so for this one, the role of the RN in home care is, of course, A. So registered nurses oversee the client's medical care, including medications, wounds, and also assessing their health conditions. But we also have to be mindful of that age group that we're working with. And so we may have to play with them and do other things, read books, etc. And so working in home care is wonderful, but you really will have to work if you deal with a toddler. That's just my little 2 cents. All right, so question 86. A patient who has been on bed rest says, I am dizzy when sitting up. What should you do? A, rub the patient's feet. B, help the patient stand to see if the dizziness goes away. C, put a cool compress on the patient's head. D, support the patient in a sitting position and wait. All right, revealing the answer in 3, 2, and yes, it is D. All right, we're not going to do any sudden movements. We're just going to let them get their balance, their equilibrium. So dizziness upon sitting up is often caused by orthostatic hypotension, which occurs when the blood pressure drops due to a sudden change of position after prolonged bed rest. The safest action is to support the patient in a sitting position, allowing their body time to adjust and stabilize before attempting further movement. And so you'd have them sit to the edge of the bed. While they're doing that, just make sure their feet are flat. You can, massage their back. They've been laying on their back for a while. And then before you stand them, just ask them about their dizziness. If the dizziness persists, you put them back in the bed. Do not stand them up. Question 87. What should a home health aide do if a family member consistently interferes with the care plan and insists on performing tasks differently? A, ignore the family member and proceed with the care plan. B, follow the family member's instructions instead of the care plan. C, politely explain that care must follow the established care plan and report the issue to the supervisor if it continues. D, leave the situation and ask the family member to care for the patient themselves. Ooh, you're feisty. Don't do D. Revealing the answer in 3, 2, and it is. I see answers now. It is C. All right, you're going to politely explain that the care must follow the established care plan. And if the person can, still insist on doing it a different way or telling you how to do your job the whole time, you need to report that to the nurse. Family members may mean well, but can unintentionally disrupt patient care by interfering with the care plan. But as a home health aide, I need you to maintain your professionalism and explain the importance of adhering to the care plan and report persistent interference to your supervisor. Question 88. Mr. Stone, who uses a wheelchair, is being transferred from the bed to the chair. Which action is essential? A, place the foot support so he can step on them. B, have a blanket draped in the wheelchair. C, place a pillow on the seat of the wheelchair. D, lock the brakes on the wheelchair. All right, which action is essential? And if you chose D, you are right, because we don't want our patient in the wheelchair moving while we're trying to actually put them in the wheelchair. It's going to be a fall hazard. So locking the brakes ensures stability and safety during the transfers. Question 89, to prevent bed sores in the elderly, you should A, change the patient position every 2 hours if they cannot do so themselves. B, get the patient out of bed if allowed. C, ensure adequate nutrition, especially protein. D, all of the above. All right, you got to slow down. You got to hear all the responses. So now give me a different answer. If you chose A, give me a different answer now. And everybody chose A. I want you to go back and reread it. Yes, it was D. All of the above prevent bed sores. So D, position changes, mobility, and good nutrition are essential for preventing pressure sores. So make sure when you take your test, make sure you read all of the answer options. Question 90. When caring for a newborn, the aide should A, support the baby's head and neck. B, clean inside the baby's ears with cotton swabs. C, use petroleum jelly around the baby's navel. Or D, hold the baby only during feeding or bathing. All right. And so as a home health aide, you could also, if you felt comfortable, you could take care of babies and children. So revealing the answer in 3, 2, and If you're holding a baby, you have to do A. Their neck muscles are not strong enough. So you're going to have to support their head and their neck in order to avoid injury. Question 91. What should a home health aide do if the client's family refuses to purchase or use necessary medical equipment, such as a walker or a hospital bed? A, respect the family's decision and continue the care without the equipment. B, document the refusal and report it to the supervisor. C, buy the equipment themselves to ensure the client's safety. Or D, refuse to provide care until the equipment is obtained. All right, revealing the answer in 5, 4, 3, 2, and that is right. We are going to document this. We're going to report it to our supervisor because she may need to get that case manager involved, because if the family member isn't going to purchase it, maybe the doctor can write an order so that insurance will cover this piece of equipment, this device. So if a family refuses necessary medical equipment, it can compromise the client's safety and care. So the home health aide should document the refusal and notify a supervisor so that the issue can be addressed with the family care team or other resources. Question 92. When caring for a bed-bound patient to prevent bed sores, you should A, keep the top sheets well tucked. B, use 2 draw sheets to reposition the patient. C, use only cotton sheets. Or D, keep the bottom sheet free of wrinkles. I know some of y'all are like, what's a draw sheet? That's the old way. We used to put sheets beneath the patient and then lift the sheet in order to lift the patient and move them up in bed or reposition them. So you don't oftentimes see draw sheets anymore. So what is the correct response, everybody? I see B's and I see D's. Well, let me tell you about B. Putting 2 draw sheets beneath a patient is going to allow wrinkles to be under your patient. And so we don't like putting a whole bunch of material beneath them because wrinkles cause bed sores. So the answer is D, everybody. You have to keep those sheets beneath that patient wrinkle free. So wrinkles in the bottom sheet can create pressure points, increasing the risk of bed sores for bed-bound patients. Smooth, wrinkle-free bedding helps maintain skin integrity and reduces friction. So we're not going to use 2 draw sheets because we know that as soon as we put 4 layers, because we fold the draw sheets, 4 layers of additional material beneath that patient, at some point they're going to gather. Is going to cause a crease in the sheet, aka a wrinkle, and that wrinkle is going to cause an indentation in that patient's skin in their back, and that's going to be an area that becomes weak and it could tear or it can cause a pressure sore. Question number 93. Which statement about range of motion exercises is true? A, if the patient cannot talk, do not explain exercises. B, all joints should be moved in all directions. C, active exercises are done when the patient does not exist. Or D, support the body parts above and below the joints during exercises. Which statement about range of motion exercises is true? Yay! It is D. So we need you to support the extremity. Look, don't be doing rotations and counter rotations, taking someone's body through multiple multiple directions unless the physical therapist has ordered that. But what you're going to do whenever you're moving someone's extremity is you're going to make sure you're supporting that joint to prevent dislocation and pain. Question 94. Foods on a liquid diet include A, chicken, eggs, and toast. B, chopped and strained foods. C, broth, tea, and jello. Or D, lightly seasoned foods. What would be on a liquid diet? Yes, Etanine. Yep, AJ. It would be broth, tea, and jello. And I specifically put green jello here because if this patient came in with nausea and vomiting, if they just had surgery, if they just had their nasogastric tube or their NG tube removed, and we say, hey, we're going to put them on a clear diet, do not give them red jello because red jello looks like blood. So you can give them the orange, the yellow, or the green, but try to reserve the red jello for a few days after, like let's say 24 hours afterwards. That way it won't appear as if they vomit blood, if they do vomit, or when they defecate, some of the jello could still be formed in their bowels and it will also look like blood in their stool. So no red jello. Thank you so much. We appreciate you. All right, question 95. Foods high in vitamin C include which of the following? Is it oranges, tomatoes, and watermelon, potatoes, raisins, and bananas, liver, beef, and chicken, or cheese, milk, and cottage cheese? Which are high in vitamin C? And this one should be easy. I expect everyone to get this right. Revealing the answer in 3, 2, and yes, everybody, as soon as we said oranges. So oranges, tomatoes, and watermelon. So the answer is A. Those are great sources of vitamin C. All right, so this should say question 96. Don't ask me why it says question 1, but question 96. If 50 cc's is left in a glass that holds 150 cc's, how much intake is recorded? Is it 90 cc's, 120 cc's, 100 cc's, or 50 cc's? So a glass holds 150, and what's left in the glass is 50. So revealing the answer in 5, 4, 3, 2, and everybody got it. It is C, 100 cc's. So 150 minus 50 equals 100. And so you would be recording that, whether it's paper documentation. Some of your agencies will have computers, laptops left in the house that that the staff will use. They're password protected. And so whether it's paper or electronic documentation, you would document your patient's intake. Question 97. What type of food is safest for a patient with dysphagia? Is it A, dry, crumbly foods like crackers, B, puree or soft foods that require minimal chewing, C, hard foods like raw vegetables, or D, sticky foods like peanut butter? All right, revealing the answer in 3, 2, and looks like Chrissy and Etnine and Bertha, you all have it. It is B. Let's see what happened there. We made my slide is wrong, so I apologize. But it's B. It's going to be parade or soft foods that require minimal chewing. So let me go to slide number 99. Looks like something's out of order there. All right, let's go here. All right. So, which food is high in calcium? Is it cheese, bananas, orange juice, or raisins? And think about the patient population that would need bananas. More than likely, somebody who has issues, who needs calcium. So the answer is not bananas, you all, who needs calcium. It's going to be somebody who has weakened bones. And so if they have weakened bones, maybe it's osteoporosis. Or maybe they're getting shorter, they're complaining of bone pain. So which food item, if you had to go to the pantry, would help that patient best? And if you chose cheese, you are correct. Dairy products are usually a great source of calcium, which would make cheese a source of calcium. Question 99. Dehydration may cause which of these problems? Is it diarrhea, swelling, constipation, or dandruff? Let's see. Let's see what you put. All right. I really want you to read question 99. Dehydration, not what it is caused by. Dehydration may cause which of these problems? Dehydration doesn't cause diarrhea. Diarrhea causes dehydration. But what does dehydration cause? Revealing the answer in 3, 2, and that is right. If someone's dehydrated, they're going to be constipated. Oh, they don't have enough fluid in order to easily allow the stool to pass. So dehydration can lead to constipation due to insufficient water for bowel movement. So the correct answer, everybody, is C. And I saw all types of answers for that one. So let me go back and look at it. Dehydration does not cause swelling. If someone is swelling, it's because they're retaining fluid, and dehydration means the lack of fluid. Dehydration does not cause diarrhea. However, diarrhea, because of the excess bowel movements and fluid loss, that could cause dehydration. All right, so now let's go to question 100. We made it, team. I am so proud of you. When should a fluid intake record be made? A, when fluids are served. B, after the patient drinks the fluids. C, every 2 hours. Or D, after each meal. And don't think about what you've seen done in the real world. Think textbook. Think perfect world. When should you record the fluids? Looks like Chrissy and Elizabeth and 7A, you all have it. You record in real time. I know we don't have enough time in the real world, but when you take your test, I need you to think of the best possible scenario. So it's not you documenting every 2 hours, because what if the patient would sleep within those 2 hours? You would document it after the patient has consumed it. So usually, I know we kind of tally everything up into 2-hour windows, but if at 9 a.m. your patient drank 240 cc's, well, then on that chart, you need to be documenting 9 a.m., 240 cc's. And if they drink more at 10 a.m., you would document it again. Again, that's real world versus this textbook world. But I need for you to be able to pass your test. And whenever you pass your test, it's perfect world. They don't care that you have 15 patients. Okay, so guess what, everybody? You did it. I am so proud of you. You completed 100 questions on Christmas. Yes, you did that. So if you have any questions, I will stay around for about 2 more minutes and I will answer the questions that you put in the chat. And on Saturday at 6:30 p.m., we will have our virtual vision board party. And I will hope that you would attend. It's free. Get some paper, get some pens, get some markers. Let's do our vision boards. Let's talk about what we want to achieve in 2025, and let's work together. I'm going to be your accountability partner in order to help you achieve those goals. So let's see if we have any questions or comments. Thank you. I appreciate you. You all are so wonderful. All right, so I don't see any questions right now, so I'll give you a few more moments to pose some questions, and if not, it is 11:09 here in Florida. I will be taking myself to bed. So Bertha, for the state of Florida, they never tell you how many questions you can miss. So for example, let's say if passing is at 80%, but you missed all of the questions involving safety, and you got every other question right. You knew the role of the home health aide, etc. Because you missed all 7 of the questions involving safety, they would deem you an unsafe home health aide, an unsafe caregiver. So just keep practicing questions, because a lot of these tests are computer generated and they may get harder as you keep missing questions. So I know that that wasn't a real answer, but it depends on the category. Every category has a different weight. And so safety questions may have more weight than your nutritional questions. Any other questions, you all? Nope, no anxiety, Bertha. You're going to do fine because you're practicing and you're a safe caregiver. You're going to do well. Hareg, I am going to be back on Saturday, but Saturday's going to be something fun. I want to do the virtual party. And then next week, I will be back on 2 nights per week, but I don't have those dates set yet. But I will put it in our community area. And I usually send out a notification on the day of to let you all know that we'll be doing practice tests. And so the practice test for next week will be CNA practice test, which will still help you as a home health aide. All right, everybody. Good luck. And thank you, Mary from Rhode Island. I would love help with fluid balance chart. Okay. Let me write that down. And that would be for Nikisha. Nikisha, can you give me more information? So are you talking about like a INO chart when you say fluid balance chart? And let me give you my email address. I'll be able to check emails tomorrow. So, Nikisha, because I'm not sure what you're requesting, and I want to make sure that I create the right video, just send me an email. Okay. And so for everybody else, if you don't have any other questions or comments, I love you. I wish you much success. Merry Christmas. And you all enjoy your evening. I will see you all in the next video. See you on Saturday at 6:30. Bye.